Today we've been telling you how to fake it till you make it, but pain is the one area where you definitely have to keep it real. And here to help us understand pain is Dr. Frida Lewis-Hall, the Chief Medical Officer of Pfizer. Welcome back to the show.
Thank you so much. It's always a pleasure. Always a pleasure.
So pain, obviously, you don't want to fake pain, whether you're denying it or over-exaggerating it.
That's exactly right. Pain is so real, and it's really important to pay attention to it because pain is really the body's internal warning system. It's what tells us that something is wrong. In fact, it's so important, sometimes people call it the fifth vital sign. And pain is also really complex, as you know, and it has many, many causes, and there are different types of pain.
And that's a good point, because acute pain, well, that's a sensation that's triggered by the nervous system. It alerts you to maybe an injury and the need to alter your behavior. It is often related to physical trauma, but it can also be due to an acute internal process. But then there's something else. That's chronic pain, which persists longer than 3 months. It affects more Americans than diabetes, heart disease, and cancer combined, which is a pretty shocking thought when you think about how many people are affected by those illnesses. But severe chronic pain, it can significantly interfere with the activities of daily living, so it's difficult to just go about daily tasks.
And the physiological and psychological components of pain can really be all-consuming and debilitating. Chronic pain can be caused by a range of things, everything from arthritis to diabetes to cancer to injuries.
And because of the changes that occur in people with chronic pain, it, of course, is a disease in its own right. And some people are reluctant to complain to their doctors, but that may make the problem worse if it means the root cause of your pain goes unexamined, or it allows a treatable condition to progress, causing even more pain.
And I understand everybody experiences pain in a very different way. So the really important thing is to understand the pain and to be able to communicate it well so that you can get the right diagnosis and the right treatment for pain. And sometimes it helps to keep a journal. And in that journal you can put all this complex information about your pain so that when you go in and seek help, you would have the information that's needed for the best diagnosis and the best treatment. And there's 7 really important aspects to pain that would be important to include in a journal like that.
Yeah, and if you include it in your journal, then you can go tell your doctor exactly what's been happening and how. And one mnemonic that we recommend is L.O.C.A.T.E.S. So L stands for location of the pain, whether it travels to other parts of the body. O, other symptoms. Maybe you have nausea, numbness, or weakness along with the pain. C, this is important, the character of the pain. Has it been throbbing? Maybe it's sharp, dull, or burning. A, aggravating or alleviating factors. What makes it better or worse? T, timing of the pain. How long does it last? Is it constant? Is it intermittent? E, the environment where the pain occurs. Maybe it's worse at work or worse at home. And S, the severity of the pain. This is subjective, but we like to use a 0 to 10 pain scale from really no pain to the worst pain ever. Helps us figure out what might be going on.
And we've said that chronic pain is really a serious illness. And in some cases, it may require going to a pain specialist to have that pain managed. But whether you're seeing your primary care physician or whether or not you're seeing a pain specialist, the important thing is to be able to communicate well so that you can get the treatment that you need. And in order to help you communicate better about pain, visit healthierworld.net.
And you can also visit thedoctorstv.com for more information. Thank you so much, as always, for being here today.
Love it. Always love being here.
And coming up, Dr. Lisa is going to share info on how you can spot a faker in the bedroom. Stay with us. Closed captioning provided by